Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former health commissioner here in Baltimore. Our goal is to bring evidence and experience to illuminate critical public health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, the producer of Public Health on Call. Today, the growing challenge of children in foster care with no place to go. Dr. Josh Sharfstein speaks with Molly Tierney, who leads the child welfare work at Accenture, the global consulting firm. She explains that change starts with redefining the problem. Let's listen.
Molly Tierney, thank you so much for joining me in Public Health on Call to talk about these headlines that we see here in Maryland, but also around the country, where kids in the child welfare system are getting stuck in places they shouldn't be.
I'm delighted to be here.
So when you read these headlines, for example, kids are being held in offices, waiting for placement, kids are being held in hospitals because there's no place for them to go. What do you think?
Oh, it's heartbreaking. And to your point, I saw the headlines in Maryland. This is a pattern that's happening across the country. You could see it taking shape in more jurisdictions than not. This particular challenge, it's a heartbreaker.
So what's happening? What is behind this?
Well, I think it's really important when trying to understand that to disaggregate the data, to unpack it and think of it not so much as a homogeneous group, but dig a little deeper into the kids we're talking about. And mostly you could see them a break in there's teenagers and then there's little kids. That's probably the most important way to break it. And they're both begging for different solutions so that teenagers in the best of circumstances are tough, but that's their work, right? That's their job, is to be difficult, developmentally speaking. And the teenagers who are in foster care who are in this situation are often either dually diagnosed, right? They have a medical condition and a mental health condition, for instance, or multiple mental health conditions, or they have a mental health condition and have touched the juvenile justice realm. And there's just no way around that, added a lot of spice to the soup that was already difficult, just the nature of being a teenager. And I think it's a lot. That's a lot to ask for a person to bring an individual of that nature into their home as a foster parent. That's a big ask. And I think there's a couple of ways to think about that. First is there are things that we could do to add more supports to foster parents who are considering taking kids in like this. But I got to be honest, I think the most important thing is that we break the habit of the way we talk about them. Because the language that's used, difficult to place, stuck, right? The words that we read in the paper and the words that we talk about when we're trying to solve problems, it has this convenient effect in our minds of anchoring this in the assumption that something's wrong with them. And I'm here to tell you, I've been doing this work for 30 years. I don't think there's anything wrong with any of us. And when we start from that place, it's very difficult to solve problems.
So let's stick with teenagers and then we'll go to the younger kids. What is missing in the system to care for them that leads to this challenge?
It's a great question. I'm going to stay in twos. There are two things I think that would be the most important thing to focus on. And the first is the most critical, and that is include them in decision-making, right? If you think about generally teenagers, what they're figuring out is how to use their own power. And they're trying to do that even under normal circumstances. They're trying to figure out, what do I have the ability to make decisions about in my own life? And for teenagers that are in foster care, they're largely excluded from decision-making, and that infuriates them, and it just makes them more difficult to work with. So I think that's the first thing, is they should be sitting at the table, and they can often drive solutions. The second thing is to get out of bricks and mortar. We often think the only way to get the kid the services they need is to get them in residential treatment or to put them in a facility, to get them in a group home. And I think that's just a method that we have to decide it's okay to get those services and supports outside of bricks and mortar and into the community where they could just live in a home and have intense mental health treatment, right? Or have additional supports in a foster home that would enable a foster parent to manage some behaviors that initially will be challenging.
So in a sense, we have told ourselves the story that there may be something wrong with these particular kids and they need to go somewhere to some facility. And so systems can pretty easily say, we just don't have enough placements. That's the problem. We just have to wait for more placements. And people will argue about that. And they're missing both the ability to listen to kids about what could help and the ability to wrap services around a more of a community setting.
I also think this is a population, they just sort of can't get a break. And when we talk about them, we start with, again, what's wrong with them. And I feel like it's really important to know, if we're talking about them, think about, all right, well, I'm going to make this up. There's a teenager named Sally. And we could start by listing her diagnoses on what's wrong with her. Or we could start by saying she loves to make TikTok dance videos. And she loves to go to the mall and go to that shop where she can buy really inexpensive jewelry and nail polish, because she loves to do that to change her look up every day. Like, right, you could, and also she's struggling with some mental illness. We're fairly certain it's organic. And the thing to know is right now, that mental illness often presents itself in aggression. And so if we understand it that way, then we get, right. This is a person for whom we need to help step into healing. Because when we start the other way, we are at, this is a person that needs to comply. This is a person that needs to behave. And again, with even typical teenagers, when you start with behave and comply, you really just don't get very far. I feel like somehow we've forgotten that these folks are in a developmental phase and they're way closer to 6 than they are to 26. They're babies and they need a lot of love and care. And if we'd start from that place, I think we'd be getting a lot more done.
Got it. Let's switch to the younger kids, because you said that was the second group. And we do see some headlines of very young kids sleeping in child welfare offices, not being able to find another place to go. How do you put that together?
I think this is very worrisome, of course. I think that this is more of a operational challenge for child welfare. In many places across the country, there's a critical lack of staff and very high turnover rates, like half of the workers that join leave in a year, like a 50% turnover rate in staff. It's impossible to run an operation. You can't sort of keep people trained enough to do all the tasks that need doing. So that's a demographic fact. There's another demographic fact that's little known about child welfare. It is overwhelmed with administrative tasks, with oversight, with forms to fill out. And so there, with this enormous volume of work and not enough people, we just drift into the narrative of scarcity. The problem is I don't have enough workers. And I think, I can't create workers, but I can define work. But I could redefine work. I could decide, all right, here's the facts. We have this many people and this much work, and that's out of balance. I have to redefine work. I have to say, let's get down to the things that matter most to us. And the thing that matters most to us is that young children are in homes and that they're seen very regularly. And that's the most important thing. And this other stuff, we can sort of let it drift. And I feel like that's a core structural and management problem that needs to be addressed. That's not easy to do. It's not easy to do because, of course, all those people that brought all those oversight measures feel very strongly about them. But it's coming to a place where it's inhibiting the ability to keep children safe. Does that make sense?
It does. And I imagine the pandemic and all the shifts in work, people resigning, probably hit this sector pretty hard.
It hit it very, very hard. And so the people that do come and join are less likely to stay because the burden of work is impossible. You can't manage 80 cases, right? Like you can't bring meaning to your day-to-day work when you show up every morning with an impossible stack on your desk. It's impossible. And so I can't change the number 80. There are 80 cases and one person. And so what I have to do is change what are the things that worker is going to do on those 80 cases and narrow that down significantly.
In your work, have you seen places or leaders who are doing this kind of rethinking that you're talking about to, reposition the child at the center of the work that they do, listen to the child, redefine work to focus on the most important things? How do you see that playing out in the real world?
I think that there are places in the country where there are signs that folks are starting to think about this very differently. Honestly, I think a shining example is Oklahoma. There's a pediatrician there named Deb Shropshire who manages their child welfare agency, and a guy named Justin Brown who manages all of the human services. And they're thinking wildly differently about how they position supports for families in communities. That's probably the most shining example. The challenge is, I can come up with other lists. There are other places, other pockets where I see it happening. The challenge is not the one or two times you see it. The challenge is that we can't get it to scale. That mountain, we just don't seem to be able to figure out how to climb to a net effect at scale that is sustained over time. And that's an enormous challenge.
Yeah, and maybe the mental models that we're using for thinking about these problems are keeping us from scaling.
I think that's the first thing to break. I think by definition, the problem is in the minds of the decision makers that care about it. I think it's really easy to see child welfare as a charitable act, right? It feels good and right to rush in and save children, and that's the narrative we often have. And I think it's important that we shift that to not thinking about it as a charitable act, but thinking about it as us acting in self-interest, right? It is in our interest to protect the few children who need to be protected. And frankly, that's a small fraction of the children who are in foster care. It is in our best interest to keep most of those children safe at home where they belong and never do the damage that is done when we bring them into foster care. It feels like we've solved a problem. We've actually created a myriad of problems. If you look at all the data, kids that come into foster care, the trauma they experience coming in, they will carry with them for the rest of their lives. It impacts their ability to be productive. They're less likely to succeed in school. They're less likely to go to college and finish a degree. They are more likely to be dependent on public systems for their entire lives. And they frankly have a lower life expectancy. I read that data recently. A person who spends any time in foster care, a weekend, has a lower life expectancy than their peers. And so I think it's time to radically rethink, is that really the tool we need to use? And when we're telling ourselves, well, the problem is I don't have enough foster parents, what we're going to do is go build facilities and get more foster parents. And if you build it, they will come. That's the problem, right? We're going to continue to lean into that as a solution. And I think it is creating a much greater problem in our communities than if we realized, if we gripped as tightly to, it is in our mutual best interest to stabilize families.
Yeah, it sounds to me a little bit like you're calling for a public health perspective on child welfare. You're thinking about the population, you're thinking about the outcomes, what really works. And, making that shift can be very hard if it breaks, long-standing ways of doing business. I wonder what you advise people who read these stories that are heartbreaking, just, the first thing you said, and have no idea what they can do to help. And I mean, there are just so many challenges, and the story may make it appear like, the problem is, one thing, when really what's necessary is a more, thorough reform of the system. What can people do?
I love this question. There's a poem that I read years ago, and the metaphor it uses is the debate between the wisdom of an ambulance in the valley or a fence on the cliff, right? Child welfare is the ambulance in the valley. And there's some of you got to send the ambulance in. When you read those things in the paper, the ambulance has already gone into the valley to help the person who went off the cliff, right? The rest of us have to go build the fence on the cliff. And that means for me as a person in my community, that I'm looking around at the people around me, that I'm noticing. If there's a family that's struggling, a kid who's always late walking to school, I don't know, anything in your community. The family is broke, like the one adult left the household, and that means somebody might be struggling. Go knock on the door and ask them to cook a little extra dinner. Right? I think that's the thing, is the ways that we can notice that people around us are struggling, because if you look around, you will see it. And we can, as communities, be helpful. I don't mean to say don't care about the thing you read in the paper. It's really important that we care. And I am moved by how many people, because the great majority read it and say, I wish there was something I could do. There might not be something you can do for that instance, but you can do something to help the people around you who you can reach out and touch never become that instance. Right? That's the thing. Is that coming through?
Yep. No, that comes through. One last question for you, though. What should we expect from our leadership in dealing with those problems we read in the paper?
Mm-hmm. This is a lovely question. I think leadership, it's important that leadership resist easy targets, right? Like, so for instance, in situations like this, an easy target is build a residential treatment center. That's easy. An easy target is, when a catastrophic case happens, fire the worker. Easy target, right? This is a complex problem. It matters that they're thinking about it in complex ways and thinking about the stuff that is hard. What's the regulation say that's inhibiting our ability to get people and families? What's the policy doing that's getting people moving in the wrong direction? How can I make sure we're prioritizing the most urgent work and freeing my people up to do that? That's hard work, but I think the leadership should be about that with urgency all across the country.
Well, Molly Tierney, thank you so much for taking this very difficult issue, making it understandable, and thank you for your work to help kids across the country.
Thank you, Josh. Anytime.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinell, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Holes Fernandez and Amber Bryan Singletary. Thank you for listening.